name is Tiana Adams. It is the 14th of the 11th, 2018, and I'm demonstrating where and how we perform a dental procedure. So I've set up a little area on our wet table, which includes one towel on the bottom layer, followed by a heat mat, another towel to protect the animal from getting heat burns, and then on top of this is an absorption pad, which will absorb all of the water. And then over here, I've got a rolled up towel, which will be used to go underneath the neck of the animal to ensure that water does not flow down the larynx, but rather comes back out through the mouth. So that is just seated where the head will be. Okay. In addition to this, I've also got a light set up, and this is a movable one so we can have a good view on the teeth. Okay. On our trolley over here, we've got a selection of equipment and instruments that will be used to both extract and scale the teeth. So starting in this little folder, we've got elevators of 4 different sizes. These are used to loosen the tooth from the, bear with me, to loosen the tooth from the surrounding gum area. Okay. In this little tray, we've got tooth extraction forceps, which in our clinic we also use them as calculus removal forceps, which isn't correct, but that's what we do. Additionally, you'd have another pair of forceps which are quite similar to these that are used to remove the calculus. But these ones, their intended use are to extract the teeth when they're loose. Okay. Next, on one end of this instrument, we have the periodontal probe, which you can see there's little lines marked on that, which are millimeter indicators, which show us when we are exploring inside the gum the depth of the pockets which are surrounding the tooth. On the other side, well, this one is used for both that and gingival recession, so how far the gum has moved back. On the other side, we have an explorer tip, which is used to detect debris and calculus subgingivally. Next, we've got a curette. It is double-sided, so one for left side and one for the right side. The curette is to remove calculus subgingivally. And the last bit of equipment we have is a hand scaler. This one is for cleaning the more fine details. So if there's a little groove in the tooth which you can't get out with the ultrasonic cleaner, that's where you'll use the hand scaler. Okay. I've also gotten out 2 kidney dishes. I'll bring one over. So the first is just filled with plain water, as well as a syringe with a catheter attached to the end. This is for when the vet is drilling, and this is for extra lubrication and to ensure that the tooth and the bone does not overheat while the drilling is in action. Our second kidney dish is filled with a chlorhex concentrate mixed with water, diluted with water, sorry. It also has a syringe with a catheter tip attached to it, and this is to disinfect under the gum line following any scaling or polishing, etc., etc. If large extractions occur, we've got a dental scalpel blade holder, we've got rat tooth forceps, mosquito scissors, and a needle holder. So these are to close up a large area when the tooth has been removed, and we create a flap which then covers the hole and ensure that nothing gets stuck in there. When we are polishing the teeth, we use a Profi paste. It is generally mint flavoured. This one is spearmint flavoured. And when we are setting up for the dental procedure, we apply a reasonable amount of this onto a gauze swab, so then we can then scoop it onto our Profi head from the gauze swab and then start to do our polishing procedure. Now, we've got two machines that we use for our dental procedures, which are just over here. Okay, so one machine is our ultrasonic scaler machine. This one is just here. So this one is used to remove plug and calculus, which is above the gum line. So you can see it's very similar to our hand scalers. We are never to use the tip of this instrument, and we just use the side parts. Our other machine that we have is a dental machine with various attachments. So one attachment is a drill piece, and the other attachment is a Profi cup, which we use for polishing the teeth. Okay. So next, I'm going to look at, attached to our dental machine, we have the instruction manual for our two dental machines that we have in clinic, which just involves instructions as to how to use them correctly, as well as the maintenance of them. So when cleaning our machines, we use methylated spirits on them to remove all bacteria and blood, etc., etc. And with every use, we replace our Profi cup. As for our previous instruments that we've got on our other trolley table, we are meant to wash each of these, which we do, with Medizyme, which is an instrument grade cleanser. So we've soaked them in that for about 15 minutes, and then we scrub them rigorously. We then rinse them following this and dry them with a lint-free cloth. After this, we can perform the sharpening procedure, in which we use a sharpening stone or rod, whichever one is preferred for the instrument itself. As for the elevators in particular, we use a wind motion when we sharpen these, and so we do this by a little circular motion of the hand. I don't have a stone to demonstrate, unfortunately, but so imagine my hand is the stone, and we'll go around with the elevator, and when we do it, it actually will create a smile-shaped line. The other instruments, whereas it's better to use a sharpening rod, so you can scrape it down and away from yourself. Once the sharpening procedure has been performed, prior to the sharpening procedure, after it, they go into the autoclave, and each instrument, if we don't have an instrument tray, which is a tray with holes underneath it, which we do not have, which means that each instrument needs to go into an individual autoclave bag. The instruments or bags then remain in this bag until they are cool and dry, and following this they will then go into our dental trolley drawer, remaining in the autoclave bag until their following use. Okay. So the final thing we need to look at today is the PPE that I wear whenever I perform a dental prophylaxis. So I've got a few things here. I've got some gloves, which are very, very important to wear when performing the procedure, as I've got hands and fingers in the mouth where a lot of bacteria is stored, especially the dirty mouths that are coming in for dental procedures. So there's a lot of bacteria in them. So prior to doing the procedure, we put on clean gloves. Additionally to this, we will have some glasses, which is very good for the aerosols that are in the air. So as we are, especially when we're scaling and little bits of calculus will come off and go flying, we don't want to get hit in the eye. We can lose eyesight if we do this. Okay, and then the last little piece that we have here is a face mask. So the face mask is, again, for the aerosols and to ensure that we're not breathing them all in, because again, it is all bacteria that we are removing and cleansing from the mouth, and it's going to end up somewhere, which it generally ends up in the air around us, then leads to us breathing it in. So these glasses, after each use, need to be cleaned. It's good if they can also be autoclaved on a plastic setting. They don't need to be in a pouch for that. They just go straight into the autoclave and the plastic setting is applied. Whereas our gloves and our face mask, immediately when we're not using them anymore, will go in the bin. And that is how we perform a dental procedure.